Good evening. I'll call the July Health and Human Services Committee meeting to order. Is there anybody from the public that would wish to address the committee? Okay. Seeing none, I'll ask that our Public Health Director, Ginger Hall, please come forward to give us encouragement, update, wisdom. Ginger, I think you need to turn your mic on. Thank you.
Yep. As mentioned previously, this event has been very different from prior public health events. Normally, if it's a meningococcal outbreak or pertussis, shortage of flu vaccine, it's very health-related, very contained within our department. But this pandemic has impacted every aspect of our world. Not always in a positive way. The guidance and regulations that we have received, we get them from the State Health Department, Forward New York, Department of Education, Department of Transportation, so we get many messages, and we try to decipher those messages and then help the community when they're calling us as a resource as to what those rules and regulations mean. So our public health staff has been very busy investigating cases. They call those cases. They identify the individuals they've been in contact with, so they become a contact of ours to trace. We do video chat with that person every day for 10 days. We then reach out to each one of those contacts for 14 days, every day through a text message. If they do not have a cell phone but have a landline, then we do daily phone calls. We provide education. We work with facilities, because nursing homes and assisted living, if they have a positive employee, that person is in isolation for 14 days. We've implemented ComCare. I mentioned that before. It's a New York State Department of Health new software they developed and implemented in the middle of this that communicates with the health commerce system, and it allows the contact tracers that they have trained, as well as each county, to now interface and transfer cases. There's times we'll get a case, but their contacts are in another county. This allows us to set up that contact and then transfer it very seamlessly over to the next county or whatever counties the individuals live in. The positive cases flow from the state, so there'll be a lab confirmed. It goes into the state database and it flows into the software. We open it up and we start our investigation immediately, so we know right away when those cases are coming in. The travel advisory of June 25th has added an additional layer of work for public health. It started with a few states and has now increased. Anyone coming into New York State from one of those restricted states, we have to contact and then put in quarantine for 14 days. Unless they're essential, they're in quarantine, they can work, but they're in quarantine after. And any means of travel, they have to be put in quarantine. So it started out that it was just direct flights, and then expanded to indirect and direct flights. They have police officers now at the airport. You can be fined if you don't complete the sheet at that time. Individuals that are traveling, whether it is to one of the restricted states and then come back to New York, there is an online form. It flows right into our ComCare, and then we're able to start that investigation for the quarantine. As of today, we had 741 what we call domestic travel, so it's a huge, significant workload. We get a lot of names that are creative. We get phone numbers that are creative, so they do complete the form. It's just not necessarily with their information. So we started working with the New York State Health Department on using their virtual contact tracers, which is the advantage of us being fully into the ComCare. They're able to access that system, and I can transfer or assign to the state virtual contact tracer. They pick up the case, they do the investigation, they complete it. If they have issues or concerns, they send it back to us within our software. We get an alert in the software. It's a hub. It goes there. We're able to click on it, identify and note what's going on with that, patient and then do our follow-up as needed. So we don't lose control of those patients. If they have any issues, we are notified. The testing is available in the county. Most of it is by appointment. I know the rapid testing got behind and they were out 2 or 3 days. The regular testing, we've had a few cases where their 10-day isolation is up by the time we get the results. So that has been behind with all the testing that's going on. Nursing home and assisted living employees are still mandated to test weekly. And any of our home care employees that go into the assisted living facilities also have to be tested weekly so that they can care for those patients. We have contracts with 2 of those assisted living, so we have to comply with those requests. The messages that we continue to enforce is for everyone to wear their mask, maintain social distancing, washing the hands often with soap and water for at least 20 seconds. We are encouraging individuals to seek health care and not put off screening. Work with their health care provider and follow the protocols to get into that office and get the care. It's been quite a time now, length of time, that we don't want them to continue to put off screening. Last week we worked with the superintendent. They have a plan that is due this Friday that is quite detailed, and part of it they need to work with county administration, public health, the CEOs of the hospital were present for collaborative discussion and implementation of those plans. They have to have a couple of different alternative plans in case someone is positive. So they have a significant amount of workload to complete by this Friday. So part of our future planning is what it will look like if and when we obtain vaccine. Will we get a full shipment of vaccine? Will it go out to providers, or will it only be the local health department? Will we get a full shipment, or are we going to have to do as we've done in the past with flu vaccine? Those at higher risk would get the COVID-19 vaccinations first and then come down as we have more supply. We're looking at supplies now because everyone else is doing the same thing, cotton balls, the Band-Aids, prepping so that we are positioned to start vaccinating as soon as that vaccine is available. And we continue to be a resource for the community. Some of it we have to do some research to understand as well, or seek the health department to give us a better interpretation. Today was a good day. We had no new positive cases. We like that. We have 26 that we are still actively following in mandatory isolation. And as I mentioned, we have 741 travelers, and we have 98. Those are mandatory quarantine. Those are our contacts that we continue to follow. We are starting to get phone calls. People feel that the contact tracing is contact tracking, that we're tracking people as they move, and they are really afraid of our text messaging. So we have to do a lot of work with the public right now, that it is contact tracing, it's asking them how they feel, they respond whether they're feeling fine or if they have symptoms. If they have symptoms, that's an alert. We make an actual phone call and ask what's going on. How do you feel? Do we need to work on getting you to health care, or are you able to stay home? Is there other needs? So we're getting more of that type of phone calls right now, that people are not happy with the travel advisory, but it is something that we're required to complete. So that's my update.
Questions? Mr. Maxson?
Thank you, Mr. Chairman. Hi, Ginger. So people are giving fake names at the airport?
Yes.
But it's any form of travel. Somebody drives here from, say, Michigan or Minnesota, was just added to the list today. They're required when they arrive to fill out a form?
They can do it ahead of time, but there's a form online that they can fill out, and it goes automatically in the system. If you're flying into an airport, my understanding they're having you complete it prior to landing or at the time so that you can drop it off at a drop box when you get off.
So if they give a fake name, we're passing that on to the state's virtual contact tracers?
No.
Okay.
I close that in their
Okay, so there's no ability to screen, they just, here you go, and then they're on their way
No.
out to the public?
No one is screening that form. It's dropped in. There's someone policing the drop box, but not policing what the content of the form is.
A follow-up question, can you, if you are one of those travelers, can you just get tested to avoid quarantine?
No. It is recommended that you get tested within 24 hours of coming into New York State, but that does not stop your mandatory quarantine.
Okay. That brings to mind the recent tournament that we had then. If somebody was tested before they came into the area and they have papers saying that they are negative, how come that was okay then, yet these travelers are not? The bass tournament. So you had individuals that tested before they came here.
And they were
Okay.
still monitored also.
Okay. Any further questions? Realistically, how do you handle this domestic travel number? I mean, you know, certainly we've gone from dealing with less than hundreds of peoples at a time to now 700 peoples. I mean, how are you really handling this task?
So by assigning it to the virtual contact tracers, they have the ability right now, because of the travel advisory, to hire additional staff in New York State to do the contact tracing. So I assigned them to 2 individuals who then have teams, and their teams are growing to take on the workload. Yeah, we tried, but we just couldn't keep up.
Yeah, yep, I can understand that. So, okay, any further questions? Yes, Mr. Maxon.
I do have one more that I forgot I had. How is our wastewater testing going?
So we have not started that. We are finishing the, we just talked about that, actually, the contract, getting it signed so that we can do that. So we're getting closer.
Good, because I think there was an article recently that said that Paris was having a spike in their septic system. So it'll be interesting. I don't think we'll have a spike, but it'll be interesting. Okay, thank you very much. Was there any additions, corrections, deletions to the minutes from last month's meeting? Okay, seeing none, we'll approve them as presented and move on to our resolution.
Let me first point out that this is a number. If an employee works 8 hours a day all year round, that's 2,080 hours in a year. Public health individually, person by person, probably put 2,080 hours in the last month. I mean, the kind of work that's being done by our public health department is just phenomenal. And we should be very thankful that we've got such a talented pool of individuals. They've worked extremely hard. They've tackled challenge after challenge after challenge, and it seems like every day there's something else happening, but they've gotten on top of it right away. Ginger just referenced she and Faith went to a gathering last Friday with all school superintendents. There was a packet like this that the superintendents were needing to go through to develop, help them in terms of guidance to give the plan. And superintendents were diligently doing that. Well, by the time we're well into the meeting, it's Ginger and Faith that are telling them, if you go to page 33, column 2, you know what it is that you're asking, and they're pointing that out. They had already taken it upon themselves to get totally up to speed on something that technically doesn't involve public health, but practically speaking, it does involve public health because of what might happen as a result. But I can't speak highly enough for what's taking place at our public health department right now, and staying on top of the game and making sure that if there's any hint of some kind of a breakout, we're on top of it right away, and they're doing contact tracing and everything else that goes with it. So just kudos to Ginger, her staff, and I'm feeling extremely guilty to invite her here tonight just to be here, because it's the one time she could be home for a couple hours. But again, very dedicated, and it's a Health and Human Service Committee meeting, so it's appropriate for her to be here. With that said, we can then go on to the first resolution of the evening, which is appointing and reappointing members to the Community Services Board.
Is there a motion? Mr. Maxon, second Mr. Navawanic. Any discussion? All in favor? Aye. Opposed? Carried.
Next resolution is amending 2020 county budget relative to additional revenue from the Redlick Horowitz Foundation for Family First Readiness Funding.
Motion, Mr. Maxon, second. Mr. Navawanic. Any discussion? All in favor? Aye. Opposed? Carried.
Third resolution this evening is amending the 2020 county budget relative to state charge social service administration account.
Motion, Mr. Maxon, second. Mr. Ferris. Any discussion? All in favor? Aye. Opposed? Carried. Any questions about the departmental reports in the packet? Any other further business to Mr. Monticelli?
Thank you, Chairman Peck, for allowing me to speak. In groups, it's always hard to know how to react, but just listening to the county administrator's comments about the director of public health, I just feel like I need to do something I want to stand up, I want to applaud, I want to do something, because it just seems to fall flat. I mean, the diligence and the effort and time, I had a job once. I remember what it was like, but I can't imagine the intensity of the job you're doing. And so I just, as one person who gets a microphone if Chairman Peck lets him speak, say thank you.
Thank you, Mr. Monticelli. Anybody can grab the mic at the beginning of the meeting. But I very much resonate with the comments that have been made here. Certainly our entire public health staff has been running full bore throughout this entire situation, along working very intimately with administration and our chairman. This is certainly an unprecedented event. Certainly, hopefully, we will come to an end at some point, or at least to a more normal life, no matter what happens, whether a vaccine is developed or not. Societal normalcy must return. But certainly the job of our public health department is right there on the front lines, right along with the nursing staff of all of our communities. So thank you very much on behalf of our committee for all the work that you and Faith and the rest of your staff have been doing. Anything else to come before the committee? Entertain a motion to adjourn. Mr. Maxon, second. Mr. Ferris, we're adjourned.
I'd like to call to order the county's Committee on Finance and Rules, our July meeting. We're going to start off tonight with a presentation by the county's auditing firm, Drescher and Malecki, and representing Drescher and Malecki is Luke Malecki.
Thank you. As the chairman said, I am Luke Malecki, the partner that was assigned to audit your county, and this was a very interesting year to audit, obviously. As far as the finances go, nothing out of the ordinary, but regarding the process of the audit, it certainly was an atypical year, being that we started our work amid the quarantine. So I want to start foremost by thanking everyone that was involved in the audit on the county side of it. It was definitely not an easy process from there when they're sitting. Normally we'd be able to pull a lot of the samples and look through a lot of the information. We're relying on the treasurer's staff, the Department of Social Services and Public Health staff to assist us with that and then scan us the documentation. And actually we're able to conduct the full audit with only one day of actual on-site field work at the end of July. As we were putting the presentation together, Karen and I always had the goal of presenting at this meeting in July, thinking that this is where we've been for the last few years. And I looked at last year, we were in August. So we actually beat last year's timeline despite everything going on. So I think that could not, I know that could not have happened without a very receptive treasurer's office and accommodating county. We met with the audit committee prior to this meeting at detail at length. So as we go through this is a very summarized presentation. My contact information is at the back of the presentation in front of you, and certainly is available through the treasurer's office. So if any questions come up after the documentation has been distributed, I'd be happy to answer those via telephone through the contact information there, or email. To get into it, the products of our audit, primarily we are hired to form an opinion on the financial statements. That's to say we did perform a series of tests on whether or not the financial statements reasonably present the financial position of the county at December 31st and for the year ended 12/31/19. After performing our procedures, as I said, we wrapped things up after phase 4 came back into play. We dated our opinion July 10th and have an unmodified opinion. In other words, that's a clean opinion. The financial statements we feel represent the financial position of the county at 12/31/19. They are the responsibility of the treasurer's office. The only thing that belongs to us within there is the professional opinion. One item that I did want to bring up is that this is the second straight year that there were no material weaknesses or no significant deficiencies within the audit report. Years ago, we would report a significant deficiency on the health of the solid waste department. We feel that that's improved to a sufficient level that no longer has to be included. I think that's important to note because a lot of times it's easy to put controls in place, but it's hard to sustain those controls. So when you have a consistent method of having a clean audit, and this being the second out of 2 straight years having that clean audit, it shows a lot of strong internal control structure within the county. To just rehash real quick, I did use a couple of terms there. A significant deficiency would be a series of control deficiencies that would warrant the communication to the Board of Legislators. And if that significant deficiency potentially could cause a material misstatement, then it would be escalated to a material weakness. Probably not important because there are none, which is a good thing. We do test a single audit. A single audit is really a component of your audit that's required by the federal government. You receive several dollars worth of grant money on an annual basis, and rather than test each individual grant that comes in, the federal government issued what's referred to as a uniform guidance, and it basically gives us some guidelines on testing more risky programs or high dollar amount programs. This year we tested 4 different programs within your county: the Airport Improvement Program, the Workforce Investment WIOA Cluster, Child Care Development Grant, and the HEAP program, the Heat Home Energy Assistance Program. We had no federal award findings in any of those, and we take a real detailed look of the internal control structure, and it's very reflective of that within the treasurer's office. So a nice consistent application of internal controls countywide as far as the departments that we looked into. The next couple of items are a couple of letters that we issue. The first letter really just deals with some required communications surrounding our responsibility, management's responsibility, as well as some key estimates and changes in the financial presentation. I won't bore this committee with that. We already bored the audit committee with that, so I don't want to do that twice in one night. Moving on to the management letter. The management letter is really any deficiency or any observations, best practices that we think would be applicable to the county. This year, we don't have anything of too much concern. We did include a letter regarding kind of a timeline of how the COVID crisis impacted counties on a financial level, at least just from the window of the quarantine from March until May. We stopped communicating that after that because I think the information became a little bit more free-flowing. But just really what we see as impacting the 2020 year and then the 2020 budget coming up. We also include within that letter some new governmental accounting reporting standards that will work with the Treasurer on implementing in future years. The last two portions are just two tiny reports that are required by different agencies. One is a state agency, the Department of Transportation. You do receive state aid with CHIPS and Marchicelli aid and such that along those lines. We are required to test that within your county because you meet a certain threshold of the state. We had no findings within there. The passenger facility charge is something new that came up with some FAA guidelines the last couple of years. We started doing that with your airport. Again, no findings within that one. So all told, it was about as clean as audit year as you can get. And this is the second year that I'm able to say that. So well done with that respect. We'll briefly go into some financial statement updates. Really, this should be just a reiteration of what the Treasurer's been telling you all along and also paint a picture of where 2019 ended up and how that's going to be affected, obviously, by 2020. So when you look at these two lines, I know the scale is a little bit tight, but the key point to mention is that for the last 4 years, the blue line has exceeded the red line. The blue line is, of course, your revenues. In 2015, we sat here and announced the county ended the year with $25.2 million. And of that, only $2.1 million was unassigned available. So the county was outside of its fund balance policy. So since then, there's been a systematic replenishment of the reserves. And all along those ways, every presentation that we'd be a part of was, well, what's the right level of funding? In your county, you determined that the ideal level of funding is about 17% of your net expenditure. So it removes the sales tax distribution that's made to the communities. The reason that number is important is because 17% is a recommendation by the Government Financing Officers Association, the GFOA, that says that you should have 2 months of spending, really to float you until your tax collections start coming in. So what your fund balance policy then is, it takes this a step further and says, well, we can either go 10% higher than that or 10% lower than that. And so there was an active replenishment, and the reason that replenishment is important is because it's a comfort zone. It's being able to have the savings account available in case a rainy day came coming on the door. Obviously, with what's going on in 2020, that moment's now, and it's nice to have the level of fund balance that you're going to end this year with, or that you ended 12/31/19 with, versus where you were in 2015. So I think it's important to show that systemic application of getting the fund balance replenished to the levels within the fund balance policy is going to soften the blow of 2020. Is it going to be a save-all? Probably not. But at least you have more fund balance available to take the hits in sales tax that are occurring and the additional costs that the county's having to incur that may or may not be reimbursed through federal funding. It remains to be seen. So when we look at going back to the 2019, kind of on a tangent on the impacts of 2020, when we look at 2019, the plan was to use about $7 million of fund balance. The revenues were budgeted to be $201.8 million. Actually, $205.3 million came in. So a little bit of a windfall on the revenue side of things. Sales tax in 2019 outperformed the budget by $5.4 million, while departmental income and state aid and state and federal aid kind of underperformed the budget by about $3 million collectively. So all told, as I said, revenues outperformed the budget by 3.5. On the expense side of things, the original budget was to use about $208.9 million. You actually used $199.9, so a savings of $9 million there. The savings within the expenditure lines is what we'd expect. Within economic assistance and opportunity, that's where a lot of your social service programs are run, and the county has the obligation to be able to budget for those costs should those programs be accessed by the public. It's never expected that 100% of all the programs are used, but the money needs to be there. So there tends to be a little bit of an excess capacity within the economic assistance and opportunity line. This year there was $6 million of savings within your DSS programs based on what was in the budget. Additionally, on a similar note, your employee benefits, you have a self-insurance for health insurance and workers' compensation, so you really have to budget for the maximum loss that could occur. You never wish for that, but you have to have it available should it be there. So you had about $2.5 million savings. All told, with those savings and some savings within public safety surrounding maintenance and repairs, you're able to save that $9 million. So instead of using the $7.1 million, we saw fund balance change to about $40 million to $45.4 million. So $45,397,489, an increase of $5.3 million. Not all of that is available for use. A portion of it, a large portion of it, is assigned for next year's budget. About $7 million is assigned for next year's budget, as well as $3 million is restricted as to their purpose. What's left is $22.7 million of unassigned fund balance, and as I said, if you rewind to 2015, that number was $2.1 million. So right now you have $22.7 million sitting in your savings. Well, not right now, but as of 12/31/19, you had $22.7 million of savings to help float any budget difficulties that are occurring in 2020. When we look at how revenues performed from one year to the next, we saw revenues increase by about 2%, $4 million. A large portion of that is within your sales tax. Sales tax did increase by 1.5% from the prior year, so it outperformed the budget by $4.5 million and outperformed 2018 by $1.2 million. State aid, although you didn't use all the money that you thought you'd use in your DSS programs, you did use a little bit more than the previous year. So we saw a little influx in aid related to those programs. That increased by about 2.8%, or $1.6 million. The other item that's within down below in the smaller category is interest earnings, increased by $400,000 in 2019. Safe to say that that's not going to reoccur in 2020, so another little difficulty in kind of plugging the gap in 2020, and what's left to be in 2021, what's the budget for next year, is really unpredictable with the economic uncertainty that we're experiencing within the state, within the country. When we look at the expenditure side of things, really the expenditures kept pace with revenues. Operating expenses increased by about 2.1%. So very close to that 2% that we saw with revenues. This is what you expect. You're kind of, in 2019, we saw the county finding its way within its fund balance policy, so we started to see that retraction and expenditures kind of eating away at the increase in revenues. Well, that's probably going to get put on a halt as we look in to see what happens in 2020. But as far as the 2019 year, that was what we expected, is that expenditures were going to start to outpace revenues a little bit more, so that that gap between revenues and expenditures tightens, and it becomes more of a sustained one-to-one ratio versus having to build or reduce fund balance. As I said, what's left to be happening in 2021 budget is going to be very unpredictable based on the projections that we're going to see in 2020. When we look at one year from the next in expenses, the first one there is the economic assistance and opportunity. As I said, that's the social service programs. Didn't hit the budgeted level, but did increase in a little bit of activity. It saw an increase of about 1.4%. The next item there, that gray box, is general government support. It's a little hard to read, but it says $59.1 million, up from $57.9. That's a $1.3 million increase. That's almost dollar for dollar your increase in your distribution of sales tax. So that's important to know, because that's kind of the cost of running the government, and that's a very, very stable, consistent pattern that we're seeing there. The only fluctuations that we're seeing over the years, because you do see it grew from 53.2, but that's from the distribution of sales tax that's grown over those years. The rest of the expenses stays pretty consistent. The only other one that you see in there that was up a little bit substantial was that $17 million there, and that's for your transfers out, and that was designed with the benefits and that revenue, that sales tax coming in. You were able to transfer an extra $1.7 million over to your capital projects fund. So that saves, obviously saves money in the bonding and any future construction costs by using fund balance. There's future interest costs by using fund balance to do those construction projects. The fund balance policy calculation, I did hit on fund balance a little bit, and I thought it was important this year because it's very important to have money available when it's raining and it is pouring right now for New York counties. A very uncertain environment as far as the state aid flows, the cash flows coming in. So any sort of savings account is being appreciated statewide within the county and municipal environment. At the end of 12/31/19, you had $31.5 million available. A large portion of that is comprised of that $22.7 million. The other portion is the 15.6 is, $16 million is for assigned. Once we remove the amount that's going to be, was planned to be used in the 2020 budget, those are other assignments. There's about $9 million of other assignments that is the director of the administration on basically earmarking funds. So technically those monies are available for countywide use, but they are earmarked for certain items such as workers' compensation and self-insurance and those sort of things, capital projects. But we include those in the calculation because technically they are unrestricted and available for use. So real brief presentation, but I did want to keep it light because it's nice out and no one likes to hear me talk about finances more than I have to. My information's up there. As I said, the treasurer has it as well. I invite any questions now, or if you'd prefer, you can certainly wait till a later date and shoot me an email, or a phone conversation is also accepted. Thanks for all your help, and it's a pleasure doing work with your county, always.
Do we have questions? Oh, come on. Don't let him off that easy.
Gotta dig deep.
Well,
they're just tired.
the mask, we're all breathing all that carbon monoxide.
It's not my content, right?
No. Well, thank you very much.
All right, thank you all.
Okay, we'll move on with the meeting. I'd like to open the floor to anyone who, anyone who has like to address the committee. Seeing no one coming to the microphone, we'll move on to the minutes of the last meeting. Any need to do anything but approve them? They'll stand as presented. Okay, on to resolutions. Starting with Finance and Rules sponsored resolution number 1.
The first resolution, very important resolution, but the first resolution of the evening, amending Resolution 113 of 1965 to increase taxes on sales and use of tangible personal property and certain services on occupancy of hotel rooms and amusement charged pursuant to Article 29 of the tax laws of the state of New York.
That's where I realize I'm glad I'm not reading them out loud. Thank you very much. Could I have a motion, please? Legislator Jarrow. Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Next resolution is amending the 2020 county budget in relation to Insurance Department Medicare Part B reimbursement.
Motion, please. Legislator Nabalani. Legislator Johnson. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Third resolution this evening is amending the 2020 budget in relation to unemployment insurance.
Motion, please. Legislator Jarrow. Legislator Drake. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Authorizing agreement with the New York State Board of Elections in relation to the Election Cybersecurity Remediation Grant Program and amending the 2020 county budget in relation thereto.
Motion, please. Legislator Johnson. Legislator Nabalani. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Appointing representative to Cornell Cooperative Extension Association of Jefferson County.
Motion, please. No one wants to make that motion? Oh, Legislator Nabalani, thank you. A second, please. Legislator Drake. Discussion? Hearing none, all in favor? Aye. Opposed? Carried. Legislator Peck. Big shoes to fill. Okay, well, I'm going to kind of change things up and go back to an old method. I think possibly I was stifling discussion by trying to move things in a group, since the votes at finance were different than the votes at the full board. So as to not do that and give people the opportunity, I think I'll go back to the, unless there's some objection to it, go back to the read them all and vote on all of them. So, motion, please.
First resolution is amending the 2020 county budget relative to additional revenue from the Red Lake Horowitz Foundation for Family First Readiness Funding.
And make that motion, please. Legislator Drake. Legislator Nabalonic. Discussion. Hearing none, all in favor? Aye. Opposed? Carried.
Second resolution is amending the 2020 county budget relative to state charge social service administration account.
May I have a motion? Legislator Jarrell. May I have a second? Legislator Johnson. Discussion. Hearing none, all in favor? Aye. Opposed? Carried. There are some other items, revenue expenditure spreadsheet, and I know there was the health benefits report was also interesting. Is there other things, any other business for the committee? Legislator Jarrell.
The what, Pat? Oh, the furlough, yes, back Monday, yep.
I wouldn't have had that answer, so thank you. Okay.
Yeah, we did call back a few of the employees in the course of time, but I would say approximately 60 will be coming back on Monday.
Anything further?
One that's kind of economic development related and potentially sales tax and other sort of things. There was a fishing tournament this past weekend in Clayton. I don't know, Scott maybe want to do a quick little summary of how well it went, because it did go very, very well. 2 years from now, it's another story.
That makes you want to work with them and for them.
And again, we didn't go after them. They knocked on our door. And the fundamental objective wasn't to try to take something away from somebody else. We try to preserve it for the North Country. So if it goes to Waddington next year, there's spin-off that's positive for us. No doubt there was some spin-off that was still positive for the folks in St. Lawrence County. So the real objective was to keep it in the North Country, and on that, I think we hit a home run, because the choice will be back and forth maybe every so often, but it's in this neck of the woods. It's not between here and California or wherever else it might be. So I think we made some major inroads.
Well, thank you for the presentation, and thank you for all the effort you put into making it happen. Anything else for the good of the order? Yes, Legislator Peck.
Thank you, Mr. Chairman. Just a couple questions on department revenue report that's in the packet here, Mr. Administrator. Office for the Aging has a large negative as far as percent of budget, a negative 15% on the revenue side. Is there any?
Offhand, I don't know. I didn't look that closely at it.
Okay.
Yeah.
But other, just as I'm going through something interesting of note, but also kind of I presume a casualty of our circumstances, the occupancy tax. Revenue at the end of January, or end of June of last year was $136,000. June of this year is $55,000.
Yeah, the first quarter was down a little bit, nothing that unusual. Second quarter was down significantly, in the 60-65% range. Hopefully it starts to bounce back for the third quarter, but clearly the hospitality industry is being hit extremely hard. There's no secrets about that. And on top of it, even when it does come back a bit, again, with the requirements under COVID-19 in terms of public health and safety, the inn isn't 100%. The inn might be at 75%, so they can control the social distancing and other factors that come into play, or the restaurant at 50% and that sort of stuff. But all the lodging folks are hanging in there, and every day is getting a little bit better, but that second quarter was really hit hard. I mean, one thing I just in a generic sense will make reference to the report you look at. It's a way to kind of, for you to see something and ask, obviously, the question, but different, on the expenditure side or on the revenue side, different things happen at different times in the as an example, with education, I did look at that the other day, it's at like 95%. Well, when we pay JCC, we pay them once, and it's, that's like a February, March kind of a time frame, something like February. So that 95% starts in February when we're 2 months into the year. I mean, that's kind of a wild example, but that's what happens. In other cases, something may look like we're not spending hardly a thing, and all of a sudden we get to October and bang. It's still a good tool for us to use to see if something is jumping up, and we'll double check on OFA, but to some extent that some of those numbers have a lot to do with the state of New York and when they're going to provide revenue streams to us, and that is anybody's guess at the moment. But anyway, it's still a good tool to use. But nothing there is really going to be 1/12, 1/12, 1/12. So we'll double check that.
No, thank you very much. I certainly understand the differences in time frames on revenues and such. So those two things I just was to ask and know.
Okay.
So thank you.
Anyone else? Motion to adjourn? Legislator Neblonic, Legislator Gerald. All in favor? We are adjourned.